My name's Alexis. I'm a mum to one, Charlie, who's 20 months old.
Hello, my name's Becky and I've got a 2-year-old daughter called Maisie.
My name's Claire and I'm mum to India, who's 2 years old.
When Charlie has a fever, it's initially very worrying and concerning because you immediately think the worst.
I generally find when Maisie has a fever, I tend to panic quite a bit. Not so much now she's a little bit older and I've got more experience of how to deal with it, but especially when the babies, if you've got no background, you've never had children before and you haven't had any information about it, it's really quite a nerve-wracking time.
When India has a fever, I start to panic. It makes me worry about what's going to come because they deteriorate so quickly. So one minute she can be well and the next minute she's been sick, she's hot, she's sweating, she's crying because of the pain.
When I didn't know what to do previously, my partner worked away. I rang an ambulance because I really didn't know what else to do. And everything turned out to be okay, but because I didn't know what to do next and the medicine wasn't working, that was the only person I thought I could ring.
My biggest concern when India has a fever is she okay? Is she in pain? Is she feeling okay? Which obviously she isn't. And you can tell quite quickly whether that she's just not herself. Maybe even before she gets a temperature, before she feels sick, anything like that. And my biggest concern is just getting India well as soon as possible and helping her relieve her temperature, relieve her pain, and just be there for her.
It is how poorly they can become from, and it is, if it does get to the point where a temperature becomes too high and she does have some kind of fit, hence the reason I rang the ambulance in the past. So it is knowing, if you can't control it with medicine, where do I go from here? Can't we know what's going to happen?
The long nights, really, when he's got a fever, you just worry that because he's only 20 months old, he can't communicate, he can't say what is hurting, what is wrong. So you just worry really that you're missing something. Are you sure it is a fever? It does concern us in regarding treating him because you've got to think about the night time. You need to make sure you've got like some medicine for the night and things like that to make him sleep a bit better and then make him feel a bit better because obviously sleep is what he needs to recover.